Mr. Chairman and members of the committee, I'm privileged to appear before you this morning to testify about unmarketing illicit drugs to youth before they start using them and how we can work to curb adult demand for drugs. My name is Dr. Cheryl Healton, and I'm Dean of the College of Global Public Health at New York University. Prior to my appointment at NYU, I worked for 14 years at American Legacy, a national 501c3 nonprofit charity with a well-respected history of producing game-changing public health initiatives proven to reduce tobacco use. Best known for its bold counter-marketing campaign for youth, Truth, now in its 16th year, the campaign has been a major part of a comprehensive national, state, and local tobacco control strategy. Together, these measures have resulted in remarkable declines in youth tobacco prevalence rates from 23% in 2000 to below 7% today. I have also served on the board of directors of the Betty Ford Policy Institute and Phoenix House, a large nonprofit drug and alcohol rehabilitation organization. Using tobacco as a case study today, it is important to understand what it took to prompt dramatic social norm change that resulted in these shifts in knowledge, beliefs, and attitudes and behavior. Public health experts know that 4 factors figure prominently in maintaining dramatic declines in tobacco consumption. First, bold, highly targeted counter-marketing public education campaigns. 2, ever-increasing excise taxes on products at the state and federal level to prompt cessation among price-sensitive consumers and to reduce initiation. Third, policy initiatives that restrict access to tobacco, safeguard the public from secondhand smoke to it, and provide access to cessation services for those addicted to tobacco products. Cumulatively, these measures combine to change social norms and save lives. Yet the unspoken fourth leg of this stool is critically important, mustering the political will to enact what we know works, even though it ruffles feathers and annoys special interests. Public health too often loses out to corporate profit motives and the associated political influence. So we fail to do what we know must be done to achieve the life-extending results we all desire. While today's discussion focuses on those who peddle illicit drugs to our most vulnerable populations, the business models are not dissimilar. Those who profit from drug sales to risk-seeking and troubled teens do so to make long-term customers of them. They care more about the lucrative sales than health. They attract young customers when their developing brains are most vulnerable to risk-taking and addiction, and then reap the long-term profits as they remain addicted and age. The U.S. cannot be safe from drug-related criminal activity without first reframing the relationship between drug use and crime, and secondly, sharply reducing the insatiable appetite for illicit drugs. This can be accomplished through the prevention of youth initiation, de-glamorizing youth use by disruptive and innovative mass media campaigns, and unselling use and inducing those who are addicted or teetering on the verge of addiction to seek very prompt treatment. It goes without saying that drug treatment needs to be broadly available and covered by insurance plans. I have provided the committee with key studies which demonstrate that well-designed and executed paid mass media campaigns improve health. In the case of the Truth campaign, youth social norms and behavior shifted first in response to a statewide Florida campaign, and then a larger national campaign. In the national campaign, after the first 4 years, 450,000 youth did not initiate as a direct result of the campaign. And in an analysis at 2 years, at least 22% of the decline in youth smoking was directly attributable to the campaign. Researchers at Johns Hopkins and Columbia Universities also concluded that in 2 years alone, the campaign averted $1.9 billion to $5.4 billion in future medical care costs. These are key lessons for the primary prevention of illicit drug use and should be applied as a basis for a new and improved program at the national level. The same impact on initiation may be achieved by powerfully hard-hitting youth-focused communications, especially designed by and for youth at the highest risk of drug use. Messages must be targeted to those most likely to initiate drug use, with compelling reasons to avoid initiation, including the fact that those profiting from their drug use are using them, even if that person is a low-level dealer they see as the friend or their boyfriend or girlfriend. The ONDCP-supported Partnership for a Drug-Free America's paid advertising campaign was sharply curtailed after a decade of persistent budget cuts. It is critical to bring it back, but restructure it so that it is truly independent of the kinds of oversight that can undermine a public education campaign's ability to succeed. This specifically means that the creative development must be paid advertising developed and placed at market rates to ensure that the work is done by the hardest-hitting, best-paid agency as possible and gets the right media placements. Youth market research has to be undertaken to appropriately target the design for subsets of high-risk youth, which will likely result in bold ads that are exceptionally unpalatable to adults and government agency staff. And I believe that point is the key reason the former campaign failed, and it did fail. Vigorous real-time evaluation to decommission ads that are not resonating with intended audiences and quickly replacing them with those that do. This is essential as ads have the possibility of boomerang effects, and it is difficult to predict those in advance. To effectively reach adults, the approach is similar, but if we persist in using a moralistic criminal justice model for those addicted and at risk, we will miss the opportunity to turn the tide on an epidemic which National Institutes of Health data suggest we have been achieving some success with and must continue. In closing, there are proven ways to reach these young, impressionable audiences and adults with successful messaging. It requires abandonment of past failed policies for game-changing new ones. Thank you.